Okay, good morning, good afternoon, or good evening to you all, and happy Thursday. Welcome back to the M&E Thursday Talks, hosted by DME for Peace, a project of Search for Common Ground. Just in case you've forgotten, my name is Jack Farrell, and I am the DME for Peace project manager based here in London. Today I'm delighted to welcome Bernadette Wright, founder of the evaluation services business, Meaningful Evidence, and author of the book, Practical Mapping for Applied Research and Program Evaluation. Bernadette joins us to lead a discussion on knowledge mapping, integrating and visualizing information across sources. Just a note, if you have a question during the webinar, you can write it in the question function on your GoToWebinar dashboard, and we will address it once we reach the Q&A section of today's discussion. I'm now going to hand over to today's guest, Bernadette. Welcome to Thursday Talks. How are you doing today?
Great, thank you, Jack. And welcome everyone. I hope everyone is having a good day. We use the word mapping to mean different things in evaluation. So I want to clear up what we're talking about today. Today, rather than talking about maps that represent a geographic area, we're going to talk about knowledge maps, also called practical maps or maps for short. These are representations of our knowledge for a practical purpose. The slide here shows an example. They are a type of diagram, model, or theory. A knowledge map is made of circles and causal relationships between the concepts. Circles and arrows, concepts and causal relationships. The concepts, the circles, can be anything that's important to your program or topic, such as for an evaluation we conducted about keeping people in care. In healthcare, some of the concepts were staying in care, access to health insurance, and communication between patients and doctors. Anything that's important to understanding your situation. The arrows show where more of one thing causes more or causes less of something else. And notice that things can have more than one cause, and the arrows can go in any direction. So how do I advance? Okay, so here's the plan for today's talk. We'll start with a few key ideas, then we'll look at why we need better causal knowledge, better knowledge maps, the 3 dimensions of knowledge that our research has identified, tips for improving our knowledge maps, some uses for knowledge mapping, and then conversations. So let's start with a few key ideas. First, looking at the outer circle, people and publications. Within each evaluation project, you have multiple key people who have an interest in your program or topic, such as community members, program leaders, staff, the program evaluator, and so on. You also have multiple publications and written materials that provide information about your topic, such as program documents, research reports, and strategic plans. Each person has their own understanding of the situation from our personal or professional experience. We all have our own knowledge maps in our heads. Each publication brings another perspective, another knowledge map. Each map is made of propositions, statements of cause and effect. For example, one proposition that a community member might say is, having affordable housing and transportation are very important for me to stay in care. A research study might add more propositions, such as providing training to doctors leads to better communication between doctors and patients, leads to better understanding of the patient's condition and better care. Each proposition is made of concepts and causal connections between the concepts, and we can visualize these as circles and arrows. A concept is a specific thing or activity, such as providing training, quality of communication, or percent of patients who stay in care. A causal relationship, an arrow, shows where more of one thing causes more or less of something else, such as more training leading to better communication. My slide is not going forward.
I think if you give it a second, sometimes
okay.
These programs stick.
So Okay. As evaluators, our job is to provide information and understanding for a practical purpose. In other words, to provide better knowledge maps. Going back to our geographic maps metaphor, early geographic maps had a small number of waypoints and routes between them. They had a lot of uncertainty and a lot of blank spots on the map. As time went on, the early geographic maps were tested and they got better and better. Today we have satellite navigation. With these more complete and accurate maps, we can navigate our world with greater chance of success of safely reaching our destination. We have not seen such progress in knowledge maps from evaluation for guiding effective action. Many sources have been saying that there's a disconnect between evaluation and practice. And the further exploration section of our book cites several of these sources. Let me share a couple of example quotes. Okay. All right, still having trouble advancing my screen somehow. And it would be really helpful because there are a lot of visuals here that it would be, there we go, okay. In a 2010 article in Generations, a publication of the American Society on Aging, Baumann and Applebaum talked about controversies in evidence-based practices. They said practitioners perceive the research community as being out of touch with the real world, and the research focus as being largely irrelevant to their practices and programs. The tension is real, and despite short periods of increased attention, efforts to bridge this gap have made little progress over the last few decades. In a 2009 Harvard Kennedy School paper titled "A Lot to Lose," a call to rethink what constitutes evidence in finding social interventions that work, Smythe and Score wrote, "The risks of continued and increased reliance on narrow approaches to determining what works are multiple and serious. We risk the loss of existing what it takes programs." They're talking about programs that do what it takes to make a difference in the lives of people who need help the most. And we risk stymieing the creation of new what it takes programs. Times like these demand that we think carefully and deeply about how we understand if a program is effective. My book co-author Steve Wallace and I thought this problem was important, so we conducted our own research. We looked at the literature in many fields: entrepreneurship, poverty, healthcare, and many others. In program evaluation and social research, from our observations, we're still using mostly very simple maps. When study authors include diagrams of their models or maps, those maps typically fit on one page at most, and usually no more than half a page. Like early ocean voyagers, we're sailing with simple scraps of maps. And these simple maps have their purposes. They are useful in some situations. They're good for communicating the key things that a social program does, or the key questions that a program evaluation will explore. However, these small scraps of maps are insufficient for effectively tackling important issues that our evaluations address. Issues like peace, access to education, economic well-being, and so on. Fortunately, some approaches are moving towards better maps, such as systems thinking, interdisciplinary research, more collaborative approaches to evaluation, and mapping technologies that can help with creating more realistic visual models or knowledge maps. And I'll show you a couple of examples of these technologies. This is a map that we created in Kumu, and you see the URL here. This is currently the mapping platform that I've used the most. And where these come in useful is when you want to make a large, complex map with a whole lot of circles and arrows. If you're making something small, word processing or PowerPoint or paper and pen will probably work well, but when you get to having a whole lot of circles and arrows that takes up more than one page, it's useful to have a dedicated software to help you organize all those causal connections. And here's an example of a map that we made with Plectica. Has some similar features. That's another one we've used a little bit. And here's an example from Insight Maker. There are many others out there. Here, these are just a few examples of the ones that we're familiar with. As evaluators, we need to create better practical maps if we are to bridge this gap between research and practice and to make our evaluations more useful for guiding effective action. Our research led us to understand useful knowledge as having three aspects or three dimensions: meaning, data, and logic. Let's look at each of these. One dimension is meaning. You want each circle on your map, each concept, each variable to be relevant and meaningful to the people involved. How can we improve the meaningfulness of our evaluations? Generally, a program evaluation is more likely to be useful when it seeks to understand and take into account the perspectives of more people with knowledge of and interest in the issue. For example, the evaluation project I mentioned that we feature in the book focused on how healthcare services organizations can better meet the needs of people they serve in the 6 communities in our evaluation. For that study, we talked with health services providers and community members from a few organizations in each of the 6 cities to get their perspective. So each group we talked to added the meaning from their perspective. There's always room for improving the meaningfulness to a higher level by incorporating the views of more community members, program leaders, and other groups. When multiple groups of people representing different interests are all saying the same thing, we're more likely to believe it than if only one person says it. While meaning is very important, it has limitations. Sometimes what everybody knows turns out to be wrong. So we also need the other dimension, data. These are the facts to back up each point on your knowledge map. These can include your own evaluation data that you collect, such as the results of a survey, observation, or analysis of data in program records. It can also include information from studies that others have done. Data help us to see whether things are really happening as we expect and what is happening. How can we improve the data aspect of our knowledge? One approach that we often see is to conduct a more rigorous evaluation study that will provide stronger evidence about the link between an intervention and its desired results. These types of studies are very important in a lot of situations. However, in our view, they are only the beginning. Each study, no matter how good the data from that study, has limitations. That's why it's always good to have more than one study. When a new medication is being tested, they run more than one clinical trial. And in the same way, we can improve our knowledge for shaping effective programs by integrating information from more evaluations and more studies. When many studies are that well-conducted studies by qualified researchers are all saying the same thing, we have more certainty in the results than if we only heard it from one study. We also need data for more than one causal connection. For your data to be useful and likely to work for your map to be useful and likely to work as you expect, and to avoid unexpected problems, you want to have the data to back up most or all of the circles in your map. We've seen many programs that incorporate ideas that are meaningful to multiple groups of key people. Many programs are also based on good data, yet those programs are not always as effective or as successful as they expect. And sometimes we seem to be studying the same thing for a very long time without making real noticeable progress. What's missing? Why don't programs get better results faster? Following extensive research on evaluation, knowledge building, and decision making, we identified a third dimension of useful knowledge that needs more attention. the logic or structure of your knowledge. This dimension is the focus of much of our book because it's an important aspect that's received less attention. Diagramming your knowledge to create a map lets you see your knowledge structure, the number of concepts, and how they're connected to each other. This dimension is based on research showing that when our knowledge has more causal connections between the concepts, it's more likely to work as we expect in application. In the example health services evaluation that I mentioned, by using knowledge mapping to integrate findings from many interviews and many studies, we ended up with a large map, well over 100 circles and arrows, lots of logic structure, which is what program managers need for understanding and tackling social issues. We have to present that in an organized way, of course, which we did. Someone once said at a conference, we need evaluation that gives us 500 answers in 1 year, not one answer in 5 years. Like the other dimensions, good logic structure is important, but not enough. A good novel may contain a lot of detail and explanation about the world of the characters, but it's totally fictional. We still need for our knowledge maps to be meaningful to people and based on good data. These three dimensions of useful knowledge are closely interrelated. By striving to improve our knowledge on all three dimensions together, each dimension helps us to avoid the limitations of the other two. We put together a knowledge appraisal matrix that summarizes key takeaways about how to assess and improve the utility of our information for working as we expect. It's available as one of the online handouts from the book at practicalmapping.com. Also, in Chapter 3 of the book, we provide a more detailed study appraisal matrix for assessing the quality of a specific study in greater depth. The key things to remember to improve the quality of our knowledge for practical action are to strive to build up a body of knowledge that includes meaning to more groups of people, data for more concepts, and from more studies, and more logic, more causal connections between the concepts. Let's look at some ways we can use knowledge mapping to integrate and visualize knowledge for effective decision making. Here's an example map that we made from a study by the U.S. General Accountability Office. That study looked at existing evaluations from the literature to see whether the evidence supported continuing federal funding for after-school programs or cutting it. We used a circle for each concept and arrows to show causal relationships that the study reported. We set up the arrows to show the data for each causal connection. That provides a systematic and transparent way to organize and present evaluation findings. People can instantly see what variables the study explored and what it did not explore. We've created similar maps for our projects with clients, and the managers and policy strategists who we've shown the maps to have said that they saw them as useful. One person said for her, a knowledge map is more useful than the traditional approach because it shows how her mind sees things. This type of map is also useful for program planning and policy making. Looking at the labels on the arrows, managers can quickly see what strategies are supported by 2 or more studies and what's only supported by 1 study or by no studies at all. And that shows where action is more likely to work as the map predicts, where we can have more confidence in taking action. The arrows show where the evidence for each causal link came from, and that shows what new information each study adds. Notice that the map also includes a concept that's not connected to anything, math and reading scores, the yellow circle. That unconnected concept is something that the researchers identified as important, but they didn't find any studies that supported a causal connection there. That shows where we may need more information and possibly where there could be a research topic for a publishable paper. Knowledge mapping also provides a way to evaluate your map on paper based on the structure of your map. This lets you assess, compare, and improve our models before putting them into action and testing them with people. These charts are based on a project that we did for a client. We can see that map 1 has better structure than map 2. It has more concepts and more connections. And when we integrate the two maps, we end up with a map that has better structure than either of the first two maps on its own. And that gives us a measure of how our knowledge is improving. Sharing evaluation findings in the form of knowledge maps supports collaboration and communication. I've used this technique to present key findings from research at conferences, and people have responded very, very well to that because it shows how each activity contributes to achieving desired outcomes. So it also can support collaboration because people can see how their piece of the map connects to the broader picture. Knowledge mapping can also support collaboration between researchers and practitioners to accelerate the field. If more evaluators make their findings available in the form of knowledge maps, that would let others more quickly see the concepts and connections emerging from the study, and it would help others to integrate the findings with other studies to gradually build more complete and better maps. I hope that you have found our knowledge mapping approach interesting. If you'd like to discuss your specific evaluation project, feel free to email me. I'm always happy to chat. You can also sign up for our bi-weekly email tips and resources at meaningfulevidence.com. If you'd like to explore further, you can also order our book. Use the discount code on the slide, Sage 2019, and save 30% at sagepub.com. And thank you for your great participation, and I'll turn it over to Jack.
Great, thank you very much, Bernadette. You've given us a lot to think about, and we have a great audience with us today, so I'm really excited for the discussion. To our audience, now is your time to get on the stage with us. We're going to open up today's presentation to questions. A couple of notes about our format for those of you who are unfamiliar with the Thursday Talks. Firstly, you can submit a question in two ways. The first is through the question function on your GoToWebinar dashboard, which will allow you to type your question. The second is to click on the hand icon to raise your hand, which will allow us to unmute your microphone so that you can ask your question live. When you do submit your question, we ask that you submit your name and affiliation. Just a note, these talks are recorded and posted on DME for Peace, so those who are not able to join us at this time can go back and listen to the presentation and our wider discussion. So I'm going to use my moderator's privilege here, Bernadette, to kickstart the discussion. And as someone who deals with a lot of log frames, you know, I think log frames have been very helpful to allow us to see causal relationships between activities, outcomes, and objectives. And I guess I know you mentioned briefly that the benefit of a map versus more conventional forms is that that's how people's brains see this information. But I was wondering if you could go into some more advantages of the map versus a traditional log frame.
Well, I haven't used the log frame specifically. I've done other types of evaluation logic models, and I would say they each have their purpose, and part of it depends on your specific purpose and use and situation. But the causal mapping approach has been particularly helpful, I've found, when you're dealing with something that is very complex. You're not sure what all the activities are and what all the causal connections are, and you're collecting information on a lot of new causal collections that you hadn't thought about in advance, and organizing all that into a map provides a systematic way to organize all of that information and present it.
Great. So I guess my next question would be, so mapping for you has a significant purpose when it comes to, for example, measuring unintended effects of an intervention.
Yeah, I think that is all. Measuring the unintended effects and unexpected things is almost always very important to ask in an evaluation, and it's sometimes overlooked. But that's something that I always like to include to find out what, not only is our map working as we expect, but how can we make it better?
Great, thank you. And I guess a lot of the people online today will be very curious as to how they can apply this kind of methodology to their work. I know, for example, I've been involved in the creation of a number of systems maps over the last couple of years, and sometimes the mapping exercise itself is quite overwhelming due to the amount of information that is thrown at the map, as well as failing to understand sometimes the causal relationships. So I guess my question is, if you were to give your top 3 tips on doing a knowledge mapping exercise, what would those 3 tips be for our audience?
Oh, great question. One would be to make your circles a noun or an action word. And keeping your circles in a consistent format makes your map easier to follow. The top 3 tips. Wow. Break and don't show too much of the map all at once. Break it when you're organized. You can have a background map that shows all the circles and arrows, but when you're presenting it to people, make it manageable and present it one small piece at a time. And yeah, so I'll just stick it with those. Those are my top 2 for now.
Okay, you heard it here. The top 2 tips: noun and
yeah, we actually have. I want to mention, if you look at the practicalmapping.com website, we have a handout that gives also more tips.
Great. We can make sure to upload that alongside the recording of today's webinar on DME for Peace. So our next question comes from Rob Jones of Practical Action. And Rob writes, what are the benefits of knowledge mapping over other approaches, including systems mapping and evidence gap maps, such as those from 3IE?
Okay, I'm not really familiar with that specific map. I'm not sure if that's the same thing. So it may be that these are different maps for different purposes. The causal mapping is specifically, it shows causal relationships, and we've looked at a lot of other mapping techniques out there, and a lot of them, they will show things that are important to the situation, but they're not organized to show causal relationships. And research in a number of different disciplines has been pointing to the idea that when we understand information in a causal way, the causal connections between things, rather than just a list of things that are important, that gives us stronger knowledge, and our understanding is more likely to actually work as we expect, and it also helps to promote learning. So for situations where you have causal relationships and that's what you're interested in understanding, that's where it can be very powerful.
And I just think building on Rob's points, like when he discusses systems mapping or evidence gap maps, the system is the situation or the community or the ecosystem within which we're working, and the linkages between the different points in the system in the map. You can see how like different things affect another part of the map. So it often allows NGOs, donors, and different programmatic groups to identify opportunities for an effective intervention, which I think Rob was getting at. I do think that there is something interesting there, though. In systems maps, you can often have an arrow that goes both ways. Is there a way in the knowledge mapping exercise to see the linkages between the noun aspect, between the circles, as well as the potential for linkages across a number of different activities and a number of different outcomes?
So what is the question? Right? An arrow can go both ways.
Okay,
and I'm not sure what the question is. Yeah.
Basically, can an arrow go both ways, and can it go between the noun, between the circles, and can the circles then go to different measures of outputs and activities? Basically, is it just one line, or can there be multiple lines going at all times?
Oh, oh yes, yeah. So yeah, an arrow can go in any direction, and it can go forwards and backwards, and we frequently see arrows going in going both ways, where two things influence each other. And actually, this is another way that the that a causal map can be used is by looking at the structure. You might where you see a loop, and this is something, that could we go into more in the book also. But if you see things like a loop where one thing leads to something else, and you have a self-reinforcing cycle, that shows potential opportunity for action that could be more productive.
Great, thank you, Bernadette. The next question comes from a friend of the Thursday Talks, Mary Dalton. Mary writes, have you seen the programs that you worked with take up and own these maps? And how well does that transfer?
Um, really, at this point, we have used it more for presenting the evaluation results, and we're still at the early stages, and we have used it. I have one project where we're still at the evaluation planning phase and using it, so we haven't had projects reach that point in evaluation. Although I will mention that I have heard from others who have used this similar technique with organizations where they have gone and revisited the map once a year and used it as a system for tracking their results.
Great, thank you for your question, Mary, and thank you, Bernadette. Our next question comes from Martine Jubmanga. Martine writes, thank you very much for the presentation. Can you please explain the slide, evaluate your map on paper? How should we analyze the graphic you presented?
Okay, yeah, so that is, you can analyze the structure of your map by just looking at the number of circles and arrows. So that gives you another way is a way of evaluating the logic structure dimension of your knowledge. And two key measures to look at there are the number of concepts, and that's the blue line. And here we can see the integrated map has more concepts than the other two maps. So that tells us, it gives us a broader breadth of understanding. Where it's covering more of the territory that's important. It's looking at more of the relevant variables. And then the second key measure is the number of connections, and specifically the number of connections with more than one arrow pointing to them. The number of concepts that have more than one arrow pointing to them, because those show things that are better understood. So, and that's the gray bar, and the orange bar is the number of connections. And this is based on the idea the real world is interconnected. So when you have a map that shows more causal connections, and it shows more things that have more than one explanation shown for it, then you have a better understanding of your situation.
Great, thank you very much, Bernadette. One question I might have there is, we're talking a lot about causal relationships, but what about correlation? A lot of people online today work in peace building, and in peace building, sometimes it's very hard to measure the direct effect that your intervention had. For example, we're measuring behavioral change or attitudinal change. Does the map, or have you used the map to map correlation as well as causation?
Yes, yeah, and that happens a lot in our evaluation research, where we have a study that might say, well, there seems to be connection. There may be theoretical reason to think there's a connection. It's happening, one happens and then the other happens, but there's not really strong evidence demonstrating a causal connection. And so and this just happened on a project that we did with a client recently, and what we did was we used decorations of the arrows. So we used a different a darker color arrow to show the connections where there actually was evidence for causation, and then the other arrows where there was correlation and some suggestion that it seemed like there was probably a causal relationship there, or there could be. We just used a lighter color arrow.
Great, thank you for explaining that, Bernadette. Our next question comes from Nele Blomestein, who's an independent M&E consultant. And Nele writes, I'm currently conducting a contribution analysis for a set of outcomes that were achieved by an Oxfam project. I'm trying to connect these outcomes by their causal linkages. That seems very similar. Do you recognize this too?
Yeah, it does seem real similar, and I could see this type of creating this type of map being part of a contribution analysis or other methods of doing the evaluation that are based on looking at the evidence for a theory.
So I know you touched on it briefly, Bernadette, but have you used this kind of mapping in the design of programs? It's obvious it's helpful to think about how your intervention resulted in X, but have any of your clients or have any of your partners built this mapping into the design phase?
Yeah, actually, in the study that we use as one of the examples that's featured in the book, looking at healthcare in 6 communities, that was actually really focused on finding out information that could be used to develop training. So that really was more in the design phase of things. And the others that have been, we've also used it as part of analyzing a new program and then using the results to then improve the design of the program during the evaluation, providing formative feedback as well as to help get ideas for the design of the next phase of the program after the evaluation.
Yeah, I think this is really interesting because I know that's working with a number of different teams across a number of organizations on program design. One of the things people struggle with is like any logical framework, any results that are laid out in a table full of text and often meaningless text to them. So being able to visualize something in this interactive map that they're articulating themselves could be a really interesting tool moving forward. I am going to give the audience one last chance to ask your question or raise your hand. Going, gone. So that is a wrap for today's Thursday Talk. Thank you very much, Bernadette, for a wonderful presentation. And thank you to everyone for joining this edition of the M&E Thursday Talks. This recording will be posted online on our DME for Peace Media Gallery later today. So please return to it, share it with your colleagues, and continue the discussion online in the comments. There's a lot to unpack here, and I hope that we continue to do that and continue to share that knowledge. We're going to be back on October 31st for an extra spooky Halloween edition of the Thursday Talks. Not quite that spooky, but we're going to be with our friends from PACT. They're going to be joining us to share their new organizational network analysis guide. It's going to be really exciting. I'm looking forward to that discussion. I look forward to seeing you online then. Thank you all. Thank you again, Bernadette. And I hope you all have a wonderful rest of your week.
Thank you.